Hello everyone, today's topic is on superior mesenteric artery. Superior mesenteric artery arises from abdominal aorta at the level of first lumbar vertebra. So we can see here abdominal aorta showing the posterior abdominal muscles as well and diaphragm. So abdominal aorta is entering the abdomen through aortic hiatus which lies posterior to the diaphragm. So this is diaphragm. And here is abdominal aorta, and we can see it gives rise to three important vessels of arteries of foregut, midgut, hindgut as celiac trunk. So this is the celiac trunk or celiac artery, and here is the superior mesenteric artery. And the lower branch is the inferior mesenteric artery. So superior mesenteric artery, it originates, means it arises from the abdominal aorta at the level of first lumbar vertebral body, that is at the level of L1. So this is L1, where the transpyloric plane is located. So it is at the level of transpyloric plane, approximately 1 centimeter below the celiac trunk. So just 1 centimeter below the celiac trunk it arises. Superior mesenteric artery, it supplies the midgut, and inferior mesenteric artery supplies the hindgut structures. So after the origin of superior mesenteric artery, so here we can identify the superior mesenteric artery. So this is aorta, abdominal aorta, and here is the superior mesenteric artery which is getting its origin from here. That is, here is the celiac trunk, and it is originates behind the just near behind the body of pancreas, and we can see it further runs in front of the uncinate process of pancreas. So this is the head of pancreas, and the uncinate process you cannot see because it lies posterior to the superior mesenteric vessels. So along with the artery, the vein is here is the superior mesenteric vein. So these together are superior mesenteric vessels. So it runs right passing in front of the uncinate process of pancreas, in front of third part of duodenum. So this is the first, this is second, and here is the third part of duodenum. So it lies in front of the third part of duodenum to enter the mesentery, and where it runs between the two layers of peritoneum. So further it enters into the root of mesentery to supply the midgut derivatives. Superior mesenteric artery runs left to the superior mesenteric vein. It terminates in the right iliac fossa by anastomosing with a branch of 𝐒𝐫𝐞 artery. So we can see it is located here. This is superior mesenteric artery, and this is cecum. We can see the cut part of cecum, and here is the appendix. So cecum and appendix are located in the right iliac fossa. So superior mesenteric artery terminates in the right iliac fossa by anastomosing with the branch of 𝐒𝐫𝐞 artery, which is one of its own branches. So finally it terminates with its own branches. Let's see the relations. Anteriorly from above downwards, it is related to the body of pancreas. So the body of pancreas is removed here. So this is pancreas. So the part of the body of pancreas is removed to expose superior mesenteric artery origin. So it is related to the body of pancreas, and it is also related to splenic vein anteriorly. So the vein going posterior to pancreas is the splenic vein, lies posterior to the pancreas towards the spleen, And posteriorly, from above downwards, it is related to left renal vein. Posteriorly, it is related to left renal vein. So here we can see the left renal vein. It is little abnormal image because the renal vein is dilated here. So posteriorly, superior mesenteric artery, this is superior mesenteric artery, it runs in front of left renal vein, and above is the celiac trunk we can see, and here is the origin of inferior mesenteric artery, and it is also related to uncinate process. So in this image we can appreciate the head of pancreas. So posteriorly it is related to the uncinate process of head of pancreas. It is related to third part of duodenum, and it is related to inferior vena cava. So here we can see inferior vena cava, which is lying posterior to the artery, and it is related to right psoas major muscle. So this is the right psoas major. So we can see the superior mesenteric artery, it runs towards the right. So it crosses the right psoas major, it also crosses the inferior vena cava, which are related posterior to superior mesenteric artery. Let's talk about the branches of superior mesenteric artery. It gives off 5 sets of branches. So inferior pancreaticoduodenal artery, this is the middle colic artery. Here the transverse colon is reflected above along with its transverse mesocolon, and it gives rise to right colic artery, ileocolic artery. And also it gives rise to some jejunal and ileal branches, so which are cut ends you can see here. These are the jejunal and the ileal branches. So all the branches arising from the right side except the jejunal and ileal branches. These jejunal and ileal branches arise from the left side of the artery. So we can see here these cut arteries are all arising from the left side of the superior mesenteric artery. So pancreaticoduodenal arteries. So inferior pancreaticoduodenal artery is the branch of superior, first branch of superior mesenteric. So here is the inferior pancreaticoduodenal artery. I am writing short form. So the inferior pancreaticoduodenal artery, it majorly supplies the head of pancreas. So we can see the head of pancreas, and also it supplies the duodenum as well. We can see the duodenum, and immediately before supplying it divides into pancreaticoduodenal arteries, anterior and posterior pancreaticoduodenal arteries, which run in pancreaticoduodenal grooves. So the anterior branches, we can see it splits here. So this one is the anterior pancreaticoduodenal artery. The one which is towards the posterior side is posterior pancreaticoduodenal arteries, and these arteries end by anastomosing with the superior pancreaticoduodenal artery, which is a terminal branch of gastroduodenal arteries. So we can see here they are continuous with the superior pancreaticoduodenal arteries, which are the branches of gastroduodenal. This is the gastroduodenal artery. Gastroduodenal artery is in turn a branch of hepatic artery proper, and hepatic artery is a branch of common celiac Middle colic artery. Middle colic artery is the second branch arising from the right side of superior mesenteric artery and supplies the proximal 2/3 of the transverse colon. So, middle colic artery divides into right and left branches. The right branch anastomoses with the ascending branch of right colic artery. So, this is the right and left branches. We can see it forms an arcade by anastomosing with the right colic artery. Right colic is in turn a branch of superior mesenteric artery. And left branch anastomoses with the ascending branch of left colic artery. So, left branch we can see. So, the right branch anastomoses with the right colic artery and left branch anastomoses with the left colic artery. This one is the left colic artery. So, left colic artery is a branch of inferior mesenteric artery. Right colic artery. Right colic artery, it arises from the right side and supplies the ascending colon. It runs to the right behind the peritoneum and divides into ascending and descending branches. And ascending branch anastomoses with the right branch of middle colic artery, which I have already shown in this image. And the descending branch anastomoses with the ascending branch of ileocolic artery to form the beginning of marginal artery of 𝗓𝐻. So, descending branch anastomoses with the ileocolic artery. We can see this artery to form a marginal artery. So, parallel arteries are all marginal. Next is the ileocolic artery. Ileocolic artery supplies the cecum and appendix. So, we can see the ileocolic artery. It gives off branches to cecum and appendix. So, and also the terminal part of ileum as well it supplies. So, to reach the ascending colon, it passes downwards towards the right and divides into ascending and descending branches. The ascending branch anastomoses with the descending branch of right colic artery, and descending, that is the inferior branch, anastomoses with the terminal end of superior mesenteric artery. So, finally, the ileocolic artery anastomoses the terminal part of superior mesenteric artery. So, we can see the anastomosing looping here between the ileocolic and superior mesenteric artery. So, let us talk about the blood supply to cecum and appendix, which is from this ileocolic branches. So, the descending, that is inferior branch of ileocolic, gives rise to anterior and posterior cecal arteries to the cecum, and also it gives rise to appendicular artery to the appendix. So, it gives rise to appendicular artery and cecal arteries, and ileal branches to the terminal part of ileum. Okay. Let us see a clinical link here. The appendicular artery is an end artery, and hence the appendix is vulnerable to ischemic necrosis if this artery is blocked. So, the colic branch runs superiorly and supplies the ascending colon. So, that is a clinical link which has to be noted here. Next, regarding the jejunal and the ileal branches, these are around 12 to 15. So, these branches are about 12 to 15 in number, arise from the left side of superior mesenteric artery. So, we can see several jejunal and the ileal branches. So, these jejunal and ileal branches, we can appreciate that they branch and anastomose. So, because of their branching and anastomosing, we can see several layers of arcades. So, we can see several arterial arcades. So several series of arterial arcades from which further branches and arise, forming second, third, even fifth tiers of arterial arcades. So the number of these arcades increase from jejunum to ileum. The arterial arcades don't directly supply the small intestine. They give off so-called the straight arteries, which are called as vasa recta. So we can see these straight arteries, these lines. So vasa recta that are longer than the arcades, and they finally supply the small intestine. The vasa recta are longer and less numerous in the jejunum than that in the ileum. So one thing to be noted here, the whole of the small intestine proper, that is the jejunum and ileum, is supplied by jejunal and ileal branches of superior mesenteric artery, except the terminal part of the ileum, which is supplied by ileocholic branch of superior mesenteric artery. Let's talk about the distribution of this artery. Superior mesenteric artery is the artery of midgut, so hence it supplies all the derivatives of midgut, and that is the lower half of the duodenum. So it supplies the lower half of the duodenum below the opening of hepatopancreatic duct, and it supplies the jejunum and ileum. It supplies cecum and appendix, ascending colon and right 2/3 of transverse colon, and also the lower half of the head of pancreas. So that is about the areas of distribution. So clinical anatomy, first is acute mesenteric ischemia. Acute mesenteric ischemia is characterized by inadequate blood flow through mesenteric arteries and can result in ball ischemia and necrosis. The most common cause of acute mesenteric ischemia is arterial embolism from a cardiac source, such as mural thrombus. When an acute mural ischemia is suspected, a biphasic CT angiogram is the diagnostic method of choice and should be performed without delay. The method is time saving and has a high diagnostic value for all the intra-abdominal pathologies. The next condition is the nutcracker syndrome. Nutcracker syndrome is the compression of left renal vein between the aorta and the superior mesenteric artery. So we can see here this side, this point, we can see the left renal vein is compressed because between the superior mesenteric artery and aorta. This can lead to renal venous hypertension, resulting in the rupture of thin-walled veins into a collecting system with resultant hematuria. So we can see the dilatation of the distal part of the vein causing venous hypertension. Further, if it is neglected, it may lead to rupture of thin-walled veins leading to hematuria, that is the blood in the urine. So treatment for this nutcracker syndrome. Conservative treatment with ACE inhibitors for mild cases and endovascular stenting in severe cases of hematuria. Superior mesenteric artery syndrome. Superior mesenteric artery syndrome, otherwise called as Wilkie syndrome or cast syndrome, or known as aorta mesenteric syndrome or aorta mesenteric duodenal compression syndrome. It is a rare acquired vascular compression which is a compression disorder in which acute angulation of superior mesenteric artery results in the compression of third part of duodenum, leading to its obstruction. Clinical presentation. Patients with SMA syndrome, that is superior mesenteric artery syndrome, may present acutely with chronic incidence, symptomology, or with acute exacerbation of chronic symptoms. So acute presentation is usually characterized by signs and symptoms of duodenal obstruction. And also the chronic cases may present with long-standing vague abdominal symptoms, early satiety, anorexia, or recurrent episodes of abdominal pain associated with vomiting. So all these are chronic symptoms. Diagnosis for this condition can be challenging because superior mesenteric artery syndrome is uncommon and symptoms can be non-specified. So it is non-specific, the symptoms are non-specific, thus a high index of suspicion is required in the appropriate clinical settings. So patients should undergo judicious testing for other disorders that can cause similar clinical features. So the diagnosis is established in patients with clinical features that suggest duodenal obstruction or non-invasive image that demonstrates an abnormal angle between the aorta and the superior mesenteric artery. Conventional arteriography may be needed for those patients in whom the diagnosis remains unclear. Management: patients may initially require gastric decompression, fluid resuscitation, and correction of electrolyte abnormalities. We suggest reversal of weight loss as initial therapy for superior mesenteric artery syndrome. This generally requires enteral nutritional support, but some patients may require parenteral nutritional support. For patients diagnosed with SMA syndrome, that is superior mesenteric artery syndrome, whose condition is not improved with conservative management, several surgical options are available, including mobilization of ligament of Treats, then gastrojejunostomy and duodenojejunostomy of those. And duodenojejunostomy may provide the best results. So these are the clinical aspects. So we wind up the superior mesenteric artery anatomy along with its clinical aspects. Thank you.